Welcome to Prevention is Better Than Cure. I'm your host, Javier Daly. Now today our topic is going to be a serious, widespread disease affecting more than 300 million individuals worldwide. Now this disease affects all age groups, whether it be infants, teenagers, school children, young adults, or seniors. You know I'm talking about asthma. Now, you might know somebody with asthma, whether it be a family member, a friend, or somebody at work. But you might be thinking, what exactly is asthma? And how does it affect you?
Asthma is a common lung condition which affects many people of all ages. There is no cure for asthma, however, it can be well controlled when you work with your GP and health professionals. You can lead a normal life by learning how to manage your asthma. Normal breathing involves many areas in your body. The air goes in through your nose and mouth, then down the main airway. This airway then branches into two smaller airways, taking the air into each lung. These then continue into smaller airways, which take the air deep into the air sacs of your lungs. Your small airways are surrounded by muscle bands, and on the inside there are mucus glands. Normally, the muscles of these airways are relaxed, and the air moves easily in and out of the lungs. People with asthma have airways which are often sensitive, inflamed, and irritable. These airways then react to things called triggers that set off their asthma. Their airways swell and get thick with mucus, and the muscles around the airway squeeze tight. This makes it hard to breathe. Common signs of asthma may be a tight chest, feeling breathless or short of breath, wheezing, and/or a persistent cough. The cough often happens at night or early in the morning, but may occur at any time of the day or night, sometimes waking you earlier than usual. It may also happen during or after exercise. Cough may be the only symptom. In young children, you may notice them using their stomach to breathe, or they may tell you they have a sore tummy or chest. These signs of asthma may come on gradually or suddenly. People can get asthma at any stage of their life. If you have had asthma in the past, it can return at any time. Half of those with asthma symptoms as a child may not have any asthma as an adult. Asthma can be different for everyone, and for some, it can be worse than others. It's important not to ignore the warning signs of asthma.
Now that you know exactly how asthma works, you might be thinking, suppose somebody has an asthma attack and they don't have the inhaler. What do they do? And what can you do to help them?
Yo dog, long time no exercise no dog.
How are you, dog?
Like the asthma you know, brother.
So you pump there?
I'm yard it there you know, brother. Just 6 months now your asthma affect me, that's why you know. I'm gonna bring the pump, you know.
Chat no dog. Yo, chat no dog, yo. You want it on?
During an asthma attack, follow these simple tips. Sit down and take slow, steady breaths. Remember to remain calm. If you begin to stress out, this will only make the attack worse. Talk as little as you possibly can, because talking is hard work on the neck muscles and may cause them to tense up. Do not run or walk fast in order to get to a particular place. This will only speed up your metabolism and make your asthma attack worse. Grab your asthma pump and take 2 puffs from it, or for more serious symptoms, use a nebulizer for medicinal relief. If you do not feel better after taking your medication or following the tips above, or if you feel worried at any time, call your nearest hospital or 110.
Now there are 2 types of asthma control relief, long term and short term. Now, long term is taken on a daily basis to help prevent or control asthma symptoms, while short term, like an asthma pump, is taken whenever you have an asthma attack or experiencing any asthma related symptoms. Now, you might not take my word for it, so it's time for our segment. Let's ask the doctor.
Asthma is a chronic respiratory condition which currently has no cure, but an allergist or pulmonologist can help you create a specialized treatment plan to help keep your symptoms under control. Medication works by reducing inflammation. One type that is inhaled directly into the lungs through use of an inhaler is rescue medication and is used during an asthma attack to alleviate symptoms in the short term. Long-term control medications like Aerobid are also inhaled. These corticosteroids work around the clock. In this way, corticosteroids can help prevent an attack or limit its intensity. Depending on the severity of your symptoms, your doctor may recommend a rescue medication alone or a combination of medications to provide long-term control and immediate relief.
Now, let's learn some more facts about asthma in today's Did You Know feature.
Did you know weather conditions such as extremely dry, wet or windy weather can worsen an asthma condition? Did you know asthma is often hereditary? Did you know asthma is the single most prevalent cause of childhood disability in the United States? Did you know, although asthma is more common in children than adults, most deaths from asthma are in adults? Did you know obesity, exposure to formaldehyde and other volatile organic substances are identified as new risk factors for asthma?
That's it for Prevention is Better Than Cure. I'm your host, Javier Daly, and remember, stay strong, stay fit, because prevention is better than cure. Thanks for watching.